Right now, you've likely heard that acronym a lot, PPE, which stands for personal protective equipment.
Nurses say there's not enough to go around, and hospitals are starting to see an uptick in COVID-19 patients. Fox 12's Camilla Ortiz spoke to a nurse today. She joins us live with what she learned from her and what Governor Brown is doing about the PPE situation.
Well, Pete, Governor Brown admitted today that things don't look great at the moment when it comes to getting more PPE. Supply chains are tapped out really around the world, and we're learning doctors and nurses are having to reuse equipment because it's better than having nothing at all. Every day, the Oregon Health Authority is announcing more positive COVID-19 cases in the state.
There has been a very significant uptick that is earlier than expected for the initial surge.
That's Rachel Gumpert with the Oregon Nurses Association, who told me today the calm before the storm is over, and nurses are getting sent in to weather it without an umbrella.
This virus can infect people through their eyes, and okay, there's no shields. People are going in there with no shields.
I talked to an ICU nurse over the phone. We're protecting her identity at the request of ONA. She told me her hospital is rapidly changing protocol as patients keep coming in, but supplies dwindle.
Goggles, which were prior to COVID, were a one-time use goggle, are now going, oh no, you can clean those and put them back on the cart.
Healthcare workers have started sending in pictures with the PPE they need to stay safe, along with snapshots of shrinking mask supplies. While ONA says the incredible response from the community with donations and DIY masks is felt and appreciated, the medical grade stuff is what providers really need. Governor Kate Brown said in a phone conference Wednesday that the situation is unacceptable, but the federal government hasn't been much help.
As you all know, we've been working to tap federal supplies. We've received about 25% of our request. I learned this morning that my fellow governors are encountering the same levels of frustration around PPE.
Brown said the feds are encouraging local governments to turn to the open market to snap up supplies, but every state is doing the same. ONA is also pushing out information about the rights nurses have to deny patient care assignments if they feel they don't have adequate PPE to protect themselves, especially if they're also in a risk category, like if they're pregnant, immunocompromised, or over the age of 60. We'll post a link to more information on that at kptv.com. Just click on this story. Reporting live in Gresham, Camilla Ortiz, Fox 12 Oregon.